One of the important decisions when we sit down to talk about the patient is the bearing type. The bearing type is going to be selected, customized to the patient to make sure that we're picking a bearing that's appropriate for the patient's use. The bearing is where the motion actually occurs, and if there's going to be a wear problem, we want to make sure that we're picking a bearing material that is durable enough for the patient. To begin with, in terms of bearings, the bearings are going to be based on a plastic socket. The plastic sockets go back to the 60s, but what's happened to the plastics over the years is the chemistry has muchly improved and our sterilization techniques have much improved so that the plastic bearings are now much more durable. With a plastic bearing, we can use either a metal ball that articulates or we can use a ceramic ball that articulates. And these two bearing types are the standard of care right now by which we measure all the other devices. The advantage of the plastic bearing is that we have 45, 50 years of experience with the plastics, and they've gotten better and better and more durable. They don't break, they don't squeak. We do know they wear, so we're constantly focusing on better plastic and better materials to articulate with the plastic to minimize the wear rate. One of the higher demand patient bearings that we have available is ceramic on ceramic. The advantage of a ceramic on ceramic surface is the wear is basically zero. The wear is so low it can't even be measured in patient usage. So that for a person who's got a very high demand, who has a heavier body weight, who's going to be more active, the ceramic with ceramic bearing generates the lowest wear rate. One of the other high-demand bearings that's been used for many, many years is a metal-on-metal bearing. Metal-on-metal bearings are still very, very important in resurfacing technology. The advantage of resurfacing technology is more preservation of the natural bone that the person has, and is an important concept within orthopedics. It's not used very often, but it's used in very selective individuals. One of the things that we've learned, though, with metal-on-metal is if metal-on-metal bearings are not carefully used, there can be a problem with the metal wear debris leading to an immune response that leads to failure of the hip. The real thing that I think sets our group apart is the understanding of how these different technologies can be used and applied. There is no one technology that fits everybody. The ability to understand the patient's needs, to understand the patient's expectations, and then to apply the technology precisely to each patient, I think is where we excel. I'm Dr. Eric Hume. I'm an associate professor of orthopedic surgery here at Penn Medicine.